My name is Henry Hoffman. I'm an occupational therapist and co-founder of Saebo. We are a medical device company that specializes in neuro rehabilitation products. Our slogan is "No plateau in sight." We feel that patients have endless potential to make further gains. The neuro rehabilitation field in the last 10 years has been quite frustrating. Oftentimes health professionals would tell their patients that they've made a plateau or no further progress is possible. We feel that it's for patients, they can continue to make progress and they don't make plateaus. I think what happens is current treatment options have plateaued or failed them. So there's been remarkable research in the last few years that have surfaced that discuss that patients can make up to 20 years post-injury make wonderful gains. A lot of the research that has come out talks about performing task-specific functional training for individuals that have mild hemiparesis or mild impairment where their wrist and fingers are somewhat limited. Unfortunately, majority of stroke survivors have a more severe hemiparesis or more severe upper limb weakness where their impairment is moderate to severely impaired, and there's very little evidence that supports any type of treatment efficacy for this group. And that's exactly why Saebo was developed, was to really work with patients that have zero or minimal hand function and limb function, and in essence, develop a device or an innovative concept that will allow these patients to incorporate their hand, to take advantage of the latest evidence-based practice. And by incorporating your hand and doing functional training, the research suggests that improvements can be made in overall arm function as well as cortical plasticity. And cortical plasticity is described as the brain's remarkable ability to forge new pathways and rewire itself. So with our Saebo product line, we're able to take those patients that are moderately or severely impaired, incorporate the latest advances in stroke rehab or neuro rehabilitation, and allow them to start incorporating their hand functionally for task-specific repetitive training. In order to qualify for these products, you need to have a minimum shoulder and elbow movement of 15 degrees of active motion, as well as a little bit of squeezing ability in the hand. So it's very minimal criteria. Once they qualify for this device, they would then go to a Saebo certified facility where in essence they would receive treatment. They would custom fit the patient with this device. Our two premier products are the SaeboFlex and the SaeboReach. The SaeboFlex is a wrist-hand-finger orthosis that allows the patients to, in essence, grasp and release. The spring system on the device reopens the fingers so functional repetitive grasping can occur. The SaeboReach is an extension of the SaeboFlex, which not only involves a device for the hand, but it also has an above elbow component. And the SaeboReach, just like the SaeboFlex, will work on grasp and release, but it will also work on incorporating functional reaching and straightening of the elbow. A majority of neurological patients not only have hand involvement, but they also have elbow involvement, so this was very important for us in the design. As far as people who are appropriate for our technology, it's predominantly stroke survivors, brain injury, cerebral palsy, spinal cord injury, anyone in essence who suffered a neurological injury that has limited arm and hand function. The typical protocol for patients when using this device is they'll go to the Saebo certified facility. They will receive treatment on a weekly basis with the goal of having a home program where they can become independent at home using this device. Typically, what happens is the Saebo products are similar to a cane or a crutch. You're going to need it initially so you can support the weakened limb. As you do function and as you help improve your upper limb and potentially reorganize the brain, you're no longer going to need the device like you would no longer need a crutch or a cane. So it really allows the therapist to come up with new, fresh, innovative ideas that they can offer these patients. Unfortunately, the traditional therapy approach for individuals that suffer a stroke or brain injury that have limited hand function is ineffective, and there's very limited research that supports it. So that was really the impetus behind why we developed the Saebo program.